November 1st is open enrollment. People are going to start signing up for health insurance, and they're going to see massive increases in their health insurance for a couple of reasons. The first reason is, of course, is that we have a ridiculous system in this country where, for some reason, adding zero value to healthcare in any fashion, we have decided that we're going to have middlemen between paying for healthcare and the citizens who pay for that healthcare and the hospitals. And these middlemen are going to be private insurers who add nothing to the process.
It's the equivalent of a mafia man taking a cut as a part of a racket.
Here's the thing. With a mafia man taking a cut, you get ostensibly protection.
Protection, right?
Like with the private health insurance system, you don't get cost controls. You don't get more efficiency. You don't get more coverage. You don't get ease of use. You don't get consistency in pricing. You get nothing. You don't get predictability. You get absolutely nothing. The federal government could provide this health insurance, and they do it already for maybe a total of over like 1/3 of the country between Medicare and Medicaid at this point. They could provide this health insurance, and it would be far more efficient. It would provide cost containment measures. It would be cheaper per capita when you add up the government and private expenditures as it exists now. It would be a much better system. We don't have that system. That's part of the reason why rates are going up. They're going to go up 18% more or less because of just healthcare inflation. Perhaps some of that is also like tariffs on medical equipment and whatnot. But they're going to go up an extra 8% because there is such uncertainty in these markets, because the Republicans are going to be booting off a lot of people from Medicaid, and B, they're going to be cutting back on the subsidies that the government subsidizes in the exchanges, which means that there are going to be less people who are going to even want health insurance. And that means that you're going to have a deterioration of the risk pool, because generally healthier people will leave the insurance market. And that means risk pools that have more concentration of unhealthy people are more expensive, and insurance companies are in the game of insurance. And so what they do is they hedge their bets by raising rates.
Let alone what hospitals are going to experience with people coming in for emergency care because they're not getting any preventative care, for example. Right, and they're going to have to bear the cost.
And they're going to increase their rates because their costs are uncovered. ER is a much more expensive way of dealing with these things. And generally, because people haven't had ongoing care, they come in with more acute problems. It's just like, you don't get your oil changed every 3 to 7,000 miles. I mean, there's a lot of different, but the bottom line is you don't get your oil changed. One day you're going to be driving your car and your engine's going to seize up, and it's going to be a lot more expensive. But here is Dr. Oz, who is ostensibly in charge of these things. He is in the Department of Health and Human Services at the CMS, essentially in charge of Medicaid and Medicare. And here he is, either just completely ignorant as to what's about to happen or out and out lying.
You mentioned at the top that you want medications to be affordable, effective, and safe for Americans. We're speaking today on the day that window shopping began in the Affordable Care Act program on those marketplaces, and that shows that unless those tax credits are extended, those subsidies, the average plan will increase for Americans by somewhere around 115%. Do you believe that Congress should extend those subsidies so that most Americans do not receive significant increases in their premiums?
Where'd you get that 115% number from?
Kaiser Family Foundation.
They retracted that. That data was run inappropriately. They changed the messaging on it. Go back and look at the website. Here's the truth. The window shopping is already revealing that the average American is going to pay who's on the ACA between 100 and 400% of poverty level is going to pay $50 total.
Pause it for one second.
Year.
I want you to just listen to what he just said. Pause it for a second there. He said the average American, and then he qualified that by saying who is earning between 100 and 104%. Well, the people who are on the ACA are 104% of poverty. The people who are on the ACA make anywhere from just above 133% of poverty up to 400% of poverty. So he's discounting a huge swath, maybe 10 million Americans who are going to be impacted by increases here. He's also wrong about the 115% increases. Pop up this thing from Kaiser. He misread this thing. Scroll down here. Yeah, there it is. Can we zoom in on that? The 114, well, it's up there. It doesn't matter.
I can read it, though. 114%.
Premium payments could more than double on average, rising by 114% in marketplace enrollees who currently receive financial assistance, the ACA enhanced premium tax credits. So my guess is that Oz saw like, okay, Kaiser says there's going to be a 26% increase in premiums in the ACA. And that is true. There's an automatic 26%. That's baked in just because of medical inflation and then insecurity as to what's going to happen with these subsidies. And then if the subsidies don't go through, the final tally is not going to be a 26% increase. It's going to be 114% increase. That is, that's a big number. There are some numbers out there right now. Let's see where this is. And these are benchmark plans. If you have a 64-year-old, now, of course, 64-year-olds are a year out from Medicare, and ostensibly, the insurance company thinks 64-year-olds are going to be possibly the most expensive outside of people who already have any type of pre-existing issues. A 64-year-old couple in Morgantown, the household income of $85K will see their premiums that were at $552 for silver plans, the lowest of the silver plans, to $4,826. That's going to increase by $4,000 per month. So that's on the highest end. That's the highest end. New York Times reports if you're age 27 and your monthly premiums without the extra subsidies, age 27, and you make $22,000, it's going to be almost $800 a year increase. If you're age 40, again, $800 a year. Age 60, $800 a year. If you make $35,000, it's going to be it's going to be over $1,400 extra a year. If you make $65,000 and you're on there, it's going to be anywhere from $80 to $920 monthly increase. Monthly. $920. If you're age 60 and you make $65,000 a year, you're going to be paying an extra almost $12,000 a year. If you make $95,000, there's not going to be any increase at all for age 27 and 40, and then just basically $8,000.
Yeah.
That's without those subsidies. This is going to hit hard, and the Republicans are scrambling now, claiming they have a health care plan, and they haven't. They haven't had one in over a decade. They tried to vote down the ACA. How many times was it? Was it like 50 times? I think they had 50, but literally 50 votes.
But John McCain was responsible under Trump 1.0 for being the vote that didn't allow that to pass. Yep. But the secret of part of what I'm, is part of the tension here is that, I mean, the House Republicans who are this beholden to Trump right now, do they not have concerns about what this is going to mean for them when every single one of them is up in the midterms in around a year and change from now? Like, I mean, the Democrats have to hold firm on this because it's the right thing to do. But if this is the only concession that they get from this shutdown, which is likely to be the longest shutdown in history at the rate that we're going, all you're doing is saving Republicans from themselves here, because they're probably terrified about what this means. Like, I saw that KFF analysis said that the average in annual premiums is $888 in 2025. And then the average marketplace consumer is going to be paying $1,900, which tracks with those percentages that you mentioned. The Democrats have to get things like in writing assurances on things like rescissions. Because what is this for if Trump can just supersede the legislative process and say, I'm going to claw back this money willy-nilly?
Exactly. And I think that's why the Democrats are actually holding firm, because they are asking for that. And there was a piece about, I can't remember where I read it, but Mark Warner, generally of the ilk of Democrats who would be getting together and forming some type of gang of
Politico,
7 or 8 and or 10. I don't know what the swing votes are. Maybe it would be a gang of 12 in this instance. And they would get together with 5 or 6 other Republicans. They would brand themselves as the moderates, and they would come to some type of agreement. But the bottom line is there's no agreement to be had if you can't trust that the agreement's going to be upheld. And that's basically it. So this is going to be, I think, I don't know what happens from here, but we'll get a sense. Robin, am I crazy as on I am. I pulled up plan options for next year. My individual plan will be $670 per month with a $17.5 thousand deductible. My current plan is $180 per month. That's nuts. And they can try and destroy the ACA, which they very well may end up doing, but they're going to do it, and they're going to have nothing. There's going to be nothing to replace it. All right. In a minute, we're going to be talking to Jeet here about this, about the SNAP benefits. That case had mentioned earlier. The judge has yet to rule, but it sure sounds like the judge is going to rule that they have to provide this money. It has been set aside in the USDA for emergencies. The USDA is trying to pretend like this money is there for emergencies involving like natural disasters. And in fact, this is an emergency because you're going to have 42 million people without nutrition subsidies.
They took that part of the website down, by the way, where they talked about that was the role for the emergency contingency fund. The USDA took it off their website. just so brazen.
I just want to read this before two things. One, got an email from a listener, Ramy. YouTube played an ICE recruitment ad today during MR as you were playing the video of the father and the 16-year-old on the way to school. I just wanted to alert you to this in case you have any ability to prevent it. We don't. We don't have an ability. It's either we get the ads or we don't with YouTube. But I will say this, F ICE, don't join ICE, don't help ICE. You can't actually get in their way, but you can be behind them and reminding people of their rights, blowing your whistles, and also calling them pigs or other farm animals or yes, you can exercise free speech.
Free speech, Adam.
also wanted to say that we got an email from the Missoula Trade Guild. Tay, I've been watching your show for a while. I know there's some people in my hometown that possibly watch your show as well. I'm trying to develop a trading and bartering system in my community to help people save a little money, help build a stronger sense of community, create more local focused social network. I was wondering if I could possibly call in sometime to talk about this project. Feel free to call in anytime at 646-257-3920. But also a great place for stuff like this is to go on the Discord because we have over 15,000 people who are on there at any given time. And I'm sure you'll find people in Missoula, but Google around, look for the Trade Guild Missoula to check that out. Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.